Excellent. Good afternoon, everyone, and welcome to the Improvement and Innovation Showcase on Workforce Sustainability, Building the Future of Healthcare. My name is Isla Voigt, and I'm the Strategic Lead for Workplace Wellbeing Partnerships here at the CEIH, and it's my absolute pleasure to be hosting the session today. I'd like to acknowledge that CEIH is based on the traditional lands of the Kaurna people and that we respect their spiritual relationship with their country. We also acknowledge the Kaurna people as the custodians of the Adelaide region and that their cultural and heritage beliefs are still as important to the living Kaurna people today. I would also like to acknowledge the other lands that people may be joining us from in today's session. So before we start, just a little bit of housekeeping. This session has been preset to keep your mics on mute and cameras turned off by default. This will be enabled during the Q&A session after the presentation, which won't be recorded. It's only the presentation that will be recorded and published. And so the recording will be stopped for question time, and we really encourage you to keep engaged with us with the Q&A function or to use your mics. Just pop your hand up and please turn on your cameras so we can see your smiling face. And finally, just before we kick off the Q&A today, there will be a quick survey for you to complete, and which we'd really appreciate you just taking a few minutes to do, as it'll assist us in the evaluation of today's event. So for those of you that are unfamiliar with the Commission on Excellence and Innovation in Health, or the CEIH for short, we're the lead agency for innovation in healthcare in South Australia, and we love bringing together consumers, clinicians and other collaborators together to turn ideas into better healthcare. So our vision is together creating health and prosperity for all. We do this by supporting the sector to come together to imagine new ideas for better healthcare. And we acknowledge that better isn't always excellent or perfect, but we're committing to measuring what we're doing so we can understand the impact that any change is happening. So what if the big idea was actually connecting all the small ideas? And this is the essence of why we host the Improvement and Innovation Showcase. It's to help connect people in South Australia and across the sector, providing a space to explore what others have learnt. And it's all about sharing ideas, improvements and innovations. So during the series, sessions are approximately 40 minutes and will be made available online following the series. They'll be up on our website. We aim to keep it pretty simple and share work happening across the sector at any stage or level of success. So not just waiting for projects until the works are completed and ready to be published. We focus on work in South Australia, but every now and again, we do showcase something from outside our state to ignite new ideas here at home. So just a quick prompt: if you have a problem or have had success in solving a problem, or you may have learnt something while you're trying to do some work, or you're really just curious about a particular topic and would like to see us explore it, please get in touch with us via the email on the screen and we'd love to hear from you. So I would now like to introduce the theme of our 17th series, which is Workforce Sustainability, Building the Future of Healthcare. This is a particularly important topic for us here at the CEIH, and as such, it forms one of our core strategic directions. We're committed to putting people at the centre of everything we do, and our workforce is the absolute cornerstone of what enables our health system to run. Our system relies on a strong and sustainable workforce to deliver safe, high-quality care. So supporting our workforce is therefore not just critical, it's foundational. Workforce sustainability as a concept, though, is multifaceted and complex. So as such, we must really start thinking differently if we're to keep up with the predicted workforce shortages and increasing demands on our healthcare system. We've really enjoyed showcasing a range of initiatives over the series from across South Australia, each approaching workforce sustainability from a different angle, from work redesign to models of care to recruitment pipelines, through to today's session around embracing our intergenerational workforce. If you've missed any of the episodes, they'll be available on our website. So on that note, it's my pleasure to introduce our speakers today. So Joscelin Powell is a respected healthcare leader with more than 12 years of experience driving strategic, operational and system-wide improvements across complex health services. In mid-2025, she commenced her role as Director Operations Improvement at the Central Adelaide Local Health Network, leading initiatives focused on service transformation, system optimisation and performance excellence. Joscelin's career spans clinical and leadership roles across health strategy, service planning, redevelopment and conditioning, and rural remote health through to digital transformation within both the public and private sectors. She's known for her transformational action-oriented leadership style and excels in navigating ambiguity, engaging stakeholders, and translating strategic vision into sustainable outcomes. Guided by strong values and a relationship-centred approach, she fosters positive, empowered and high-performing teams. Joscelin was the previous chair and continuing member of the SA Health Young Professionals Group and led the delivery of statewide conferences, professional development workshops and the launch of the 2025-2030 strategic directions, amplifying early career voices and shaping the future workforce, which will be great to hear more about that today. Joscelin holds a Master of Health Administration and a Bachelor of Podiatry and is a certified health informatician in Australasia and a Prince 2 practitioner. She's recognised for her integrity, strategic foresight and unwavering commitment to advancing compassionate, future-ready healthcare. What more could we ask for? Sarah Hardy is a Southern Adelaide's local health network manager of organisational development and an established and influential leader with 10 years experience specialising in the human resource management, organisational development and learning fields. With degrees in management, international relations and psychology, Sarah prioritises translating theoretical knowledge to help leaders understand their impact and apply practical, people-focused solutions. Passionate about creating inclusive workplaces and addressing systemic barriers to success, Sarah's certifications in Pro-Sci change management methodology and resilience at work toolkit help her to support leaders with cracking the code where performance meets wellness for individuals, teams and organisations. If you're not sure what any of this means, no worries, just ask her. She'll happily spend hours chatting, going on tangents, exploring your context and making recommendations to support your organisations and people to thrive. So I will now hand over to our speakers today.
Thank you for that lovely introduction, Isla. It's generally a privilege to be here today, especially to speak on a topic I'm really passionate about. As an allied health clinician by background, I've always connected to why we do what we do for our patients, families and communities we serve. Even as my career has moved into more strategic system-level roles, the grounding has never left me. In my current role and in many previous ones, I've been fortunate to work on major capital projects across the state. It's incredibly exciting to design new spaces, improve infrastructure and plan for the future. But you quickly recognise that something important. None of this matters if we don't have the people, the skilled, passionate workforce to bring those spaces to life. With demand increasing and services expanding, our greatest strength is and always will be our people. And that's why I'm genuinely thrilled to be talking about this topic today.
Agreed, absolutely. And thanks, Isla, for that warm and lovely introduction. While not a clinician myself, I always try to view the work through the eyes of my grandparents, who are regular consumers of the local health work I now have the privilege of calling home. Before we do get any further into our showcase, it is really important to me that I add to that acknowledgement of country that Isla shared and recognise the privilege that we have to walk on Kaurna country. For me, when I look at Aboriginal artwork, I'm always attracted to the concentric circles that represent a meeting place. And what I know and I've understood of Aboriginal community is this long-held respect for elders and the enviable tradition of yarning circles that often happen at those meeting places. Not only can we learn from the strength of the intergenerational approach, but one that respects and upholds the values, cultures and traditions of those that came before us, while charting a new way forward for reconciliation.
Well, we hope to leave you today with a sense of inspiration and some practical ideas on how you, in your own healthcare organisations and services, can tap into often untapped potential of new generations. We want to offer you not just insights from the research, but also what we've personally seen play out in practice. Sarah and I first connected through our work with the Young Professionals Group between 2021 and 2024, before which she moved to her current role in CALHN. As former chair and now the continuing steering man committee member, I remain incredibly passionate about ensuring the voices of young professionals is included in the way we work across the system. When I first met Sarah, I remember thinking, wow, she really knows her stuff. She was so professional, so process-driven, and held all of us to such a high standard. Later, we'll dive into exactly why those qualities were so fundamental for the success of the YPG. During this presentation, we'll share a little bit more about the work of the YPG as a practical example of how these strategies, trends, and generational insights came to life. We also recognise that today's audience extend far beyond SA Health, so where possible, we'll speak to these ideas, apply them at all scales in all parts of the healthcare sector, even though our project Spotlight involved working with an organisation of more than 50,000 people. A lot of what we're showing today comes from our combined experiences. I've worked across multiple LHNs, regional and remote health, private practice, and aged care, together with research from my recent master's degrees and Sarah's deep expertise in organisational development and experience working across both health and education sectors. And on a personal note, as young professionals ourselves, we've both found that we thrive in environments where we're heard, where our ideas are valued, where we're trusted with flexibility, and we're driven by shared goals of improving outcomes for the people and the communities we serve. A quick overview of the agenda. We're going to go into what matters and why this topic is crucial for the future success of the South Australian healthcare system, the strengths of a multi-generational workforce and how these differences can be a strategic advantage. And then we'll go into the young professionals group and how our work, insights and strategies align perfectly to today's presentation. So let's take a pause. In the context of innovation and improvement, we know that personally and an organisational sense of thriving results in better performance efficiencies, and it stems from the pursuits and maintenance of well-being, joy in work, and ensuring meaning and purpose. More often than not, we anecdotally hear people are surviving. How do we ensure that they are thriving? As healthcare workers and professionals, we rarely get the time to pause and reflect on our careers or the resources we need to do our jobs well. Yes, we might engage in a reflective practice for CPD points, but this kind of reflection is rare. So our gift for you today is a moment of reflection. Take a pen, use your phone apps, Word doc, or the screen you're listening to, and answer some of these questions for yourself. Reflecting on the beginning of your career in health, what support would have made the most significant difference to you? Did you have good support when you first started your career in health? If yes, why? And if no, what could have been better?
I'll give you 30 seconds to reflect and think about it, and we'll come back for part 2.
Now, part 2, thinking about others. For the people you work alongside with, do they have the tools and support to thrive currently in the workplace?
Now, I wouldn't be an organisational development professional if I didn't try and attempt to capture some of this insight and create a shared perspective of what you've thought. So on the screen you can see now is a poll. Use the QR code there, or you can go to slido.com and enter in the number there, which is 2458756. Answer the question for us, and what will hopefully pop up is start seeing a word cloud. Reflecting on the beginning of your career in health, what support would have made the most significant difference for you? We've already got one participant typing. Fantastic. Mentoring. Tick. I'm not surprised to see that there at all. Authentic mentorship. I'm fascinated to know the difference. I'll be asking you for a bit of engagement in the Q&A at the end there. Education, regular check-ins, timely feedback, coping strategies. Still got 3 more, 6 more people typing. Investment of time, coaching, unbiased views. We'll definitely tap into some of that a little bit later in our presentation. Transformational leadership, safe environments. Yeah, that's certainly a theme of what we're going to talk about today as well. Access to PD. Well, funny about that, the young professionals group. I'm just kidding. We will try not to plug too much. So part 2 of that is thinking about the people you work alongside. Do they have the right tools to support and to thrive currently in the workplace? And here we're asking not one or the other, but do they have both? Do they have the tools and the support to thrive? We're looking for a bit of a score, an average, whether or not across the healthcare industry we think we're thriving at the moment. I'm interested to see how it's kind of sitting in that 3 or 4 backwards and forwards. So there's a little bit of ambiguity maybe whether or not we're thriving. Maybe there's one, maybe there's tools, maybe there's support, but they're not necessarily connected. As you respond, it looks like it's shifting down towards a slightly more middle of the road average. And that ambiguity is something that is so important to clarify if we've got those tools and supports in our workplaces. It's become a really well-known concept that diverse perspectives on a team result in better decision-making. These fresh perspectives look at challenges from as many divergent perspectives as possible before converging on that new way forward. They all lead to innovation. But if those diverse perspectives don't have the right supports, ironically, to share their voice, to feel genuinely included in the conversation, decision making actually gets worse. And that's because if the structure and the safety is missing, decisions slow down or they become lower quality, and that results from breakdowns in good communication, conflict mismanagement, high ambiguity in roles and responsibilities. We'll share a little bit more about these strategies in action later on, but from my time working on building the Department for Health and Wellbeing's diversity, equity and inclusion strategy last year, I know firsthand just how much of a positive impact that ensuring opportunities for listening to a broad range of perspectives with respectful inclusion has on accelerating organisational strategic goal realignment and performance.
Thanks, Sarah. We're anticipating seeing 5 generations working in the next 5 years, with multiple bodies of research showing that multi-generational workforce is more productive. With higher levels of reverse mentoring, both formal and informal, both younger and older workers benefit from each other's perspectives and life experiences. When multiple generations are around the table, ideation is richer and decisions are sounder. So again, we ask you to reflect on some of these structural supports in your workplace. Do you have good representation around the table for your meetings? Is it a safe environment for you to voice your own ideas, opinions and perspectives? Are there opportunities for reverse mentoring or feedback from both ways? Have you normalised conflict as a productive discomfort? Is the way that you make decisions in your organisation clearly communicated to everyone? In healthcare, I've always believed that when staff feel supported and given the opportunity to truly thrive, the communities we serve receive the best possible care. And the research absolutely backs this up. When we design our environments around thriving rather than surviving, everything shifts. We become more innovative, we become kinder to one another, we work more efficiently, and ultimately we deliver better outcomes together for the people that rely on us. We also know that expectations of health are changing. We're balancing an ageing population with a new generation entering the workforce, each with different experiences, values, and expectations. That means we need to ensure younger generations can deliver person-centred care to the people whose needs, preferences, and understandings of the system may be very different from their own. So why now? So this brings us to this great question of why now? And of course, what's a presentation without some fun statistics? You may already be familiar with many of these numbers on the slide, but they're a powerful reminder of just how significant our workforce challenges have become and how dramatically our workforce demographics are shifting. These figures have been tossed around for the last 5 years, and for good reason. In 2022, NIH projected that global shortage would be around 18 million health professionals by 2030, whereas the World Health Organization have estimated at 10 million just 2 years ago. And when we reviewed it again, it was 11 million only just last year. And this trend is only heading in one direction. If we don't make healthcare roles attractive and sustainable for the next generation by redesigning the systems they work within, these shortages will continue to deepen. And it's not just a workforce problem, it's a strategic risk. If we ignore it, we're going to see more and more workplace conflict, miscommunications, lower job satisfaction, high turnover, and declining organisational commitment. All of which pulls us away from our core purpose, delivering the best possible care for all South Australians. The key insight from the research: sustainability depends on recognising and leveraging generational differences.
It's certainly a competitive market out there. That's no shock to anyone working in healthcare. And if you aren't thinking about your staff attraction, retention and leadership pipelines, the organisations and teams will feel it now more than ever. The cost of losing talent, it's right there up on your screen. I think if you could save your organisation $700,000, who wouldn't buy into that the best investment? And a recent survey found that over half of healthcare employees, 35 and under, aren't planning only that, just over 50% are planning to stay in their organisations for the next 3 years. With the research helping us to understand that beyond the face value statistics signalling a possible retention crisis, because healthcare has the highest job mobility in Australia, with 13.3% of workers changing jobs in 2024, the most of any sector. Think about turnover in the context of a competitive environment then, and what we know about newer generations valuing mobility more than previous generations have before. On the flip side of that, we know there's also an increased unwillingness to tolerate unsatisfactory work environments. Are we making the most of that predicted interest in mobility? Are our systems designed and processed to allow for that kind of agile working and moving around? Or are we still interpreting these statistics with a traditional view of stability equaling a meaningful career? In this competitive talent and traction environment, we're also navigating that really complicated healthcare landscape that I know most of you will already be hyper aware of. That workforce fatigue and post-pandemic burnout is driving higher turnover rates across all generations. That digital transformation and rapid adoption of EMR, AI, telehealth requires new skill sets being actively invested in organisations. And we've also got changing expectations of work, as young professionals are leaving for roles that offer more flexibility and purpose, and others are following suit. However, we know with any challenge, we always have the other side of that coin, which is the opportunity. Moving from a survival mindset to a sustainable growth mindset through leveraging diversity. Now, before we get into the depths of looking at the generations and the strengths that they have, stereotypes can be more harmful potentially. Since the advent of unconscious bias training in workplaces, numerous research has actually questioned its efficacy for achieving the desired result, better inclusion. What's more is explicitly naming those negative stereotypes during training can unintentionally make those ideas more salient and increasing stereotype activation rather than reducing it. What we want to highlight is that we're sharing these trends to follow on the trends that are to follow on generations that help you to understand or piece the puzzle together from a strengths-based approach. We don't suggest in any shape or form blanketing this to all who may fit into the generation just because of the year that they were born. You'll often see opposites in some individuals that do not fit these trends at all. The reason we want to highlight this is because we know you as the audience want to hear the practical things that are identified in the research to start preparing for you what you need to do to sustain your workforces. And we strongly recommend that you take the time to hear the individual as a person, not just as a group or category. Strategies should involve, wherever possible, that person-centred approach that we think about and know about in healthcare so often when we're delivering care to patients. Ask people, don't assume, look at the trends, yes, absolutely, but ensure they're backed up with practical tools and systemic changes. So I don't know about you, but I can never remember which generation is which, what their names are. So to stop you Googling mid-presentation, please pause for a moment and take a screenshot so you can refer back to it. There's always a bit of debate sometimes about the overlaps, when one starts and another ends, but hopefully this gives you a bit of an idea. So why do we even talk about generations? They're social constructs that help us to group people with like experiences, norms, and attitudes towards the changing world. And each generation typically brings distinct values and attitudes and expectations that are shaped by social, economic and technological contexts that were building as they were growing up. So why do we then value and talk about generations as an important factor in the workplace? Well, my view anyway, is that because there are psychological and sociological dimensions that create a sense of belonging and identity that give people comfort and certainty. As humans, we crave connection, meaning and purpose. Generations and talking about them in those sort of fixed mindset and boxes helps to give us that. Again, in my view, it should be treated as no different as other endeavours of trying to understand workplace motivations or inclusion programs for employee engagement and retention. Understand what motivates individuals and groups. Celebrate and recognise the strengths that difference brings. Listen to the ideas, create spaces where people feel like they can belong with their whole selves and be really truly valued for their contributions. And as we explore these strengths, it's important to also recognise the key pattern across those generations, because each generation challenges the rigidity of the previous one, introduces flexibility, technology, and inclusivity are all progressed. It moves from hierarchical and process-driven work to networked and purpose-driven work cultures. We're all the new generation. We're working with a different generation than your own. Build empathy by respecting what has come before and what's going to come next. So again, we love interaction, we love a poll. We're really curious to know, what generation do you belong to in the audience? And maybe we'll share ours afterwards once we've got a few coming up on the screen. But I think you can probably guess, we've already told you that we're young professionals, which means we're at least 35 or under. Gen X, millennials. Oh, we got a lot of millennials, interesting. Mostly millennials, okay, so we're talking to our peers. We don't have to sell this story too much. And Gen X. Well, that's, you know, largely representative of what we're seeing as the people who are driving innovation are the millennials, the Gen X, the Gen Zs. So I'm so glad that you're here joining us.
So what we say overarching as a collective for new generations in the workforce, millennials, or Gen Y as I like to refer to it, it's the strengths that we're tech savviness, collaboration, and we're purpose driven in our work and the way that we go about our work. In our innovation, it's definitely about accelerating digital transformation, that remote work culture and values-based leadership. And we challenge traditional career ladders, pushing for continuous feedback, flat instructions, and meaningful work. Generation Z, digital natives, entrepreneurial and socially conscious. And their innovation is definitely driving AI adoption, gig economy models, and diversity, equity, inclusion initiatives. The challenge is redefining the work norms by demanding authenticity, mental health support, and sustainability in business practices. And then excitingly, Gen Alpha, which hasn't quite entered the workforce yet, but I'm sure will very soon, they're going to be hyper-connected, AI-influenced and globally minded. And they have the potential to likely push automation, immerse in technology, and personalised work experience even further. They will likely question the concept of job itself, leaning towards more project-based and fluid work ecosystems. Apologies. I'm pretty excited by that, just listening to those generations and what they bring in strengths. So
absolutely. And on the flip side of that is the experienced leaders in the workplace and the workforce, even those who may have retired or are reducing the time that they do spend in the workforce, they have the strength that needs to be tapped into for sustainability. It's all about balance. If we remove these generations from the workforce overnight, I posit that systems would actually crash because you're removing an essential part of the organisation. It would be like performing a lobotomy and severing the connection to the habitual part of the brain, the organisation from that executive function. They can't make effective decisions or thrive without one another. What they bring, you can see on the screen there, is that significant wisdom, the crisis resilience. They've seen it all, nothing phases them, and they have that capacity that you've shared and talked to with us about wanting to have that mentoring and strength of giving back. As an advocate of a positive psychology approach, we focus on strengths, values, motivations, and preferences, and we share this table to help build a bit of empathy and understanding about possible attitudes within generation trends that are evident. High-performing teams and organisations need to seek a balance of all of these strengths, not just one, and look for opportunities to create working conditions that all of us can thrive within. I suggest using this as a starting point in seeking perspectives. When talking to people, ask what their attitudes are towards an ideal workplace, what it might be. When we're part of the dominant cultural norm, so today, most of us are millennials, it's actually hard to identify the features and how we think about the world because they feel so natural to us. My personal biggest realisation of this was when I was studying. I distinctly remember trying to write an assignment about empathising with the Aboriginal consumers and having this sense that I didn't have a culture. And it wasn't until I started being able to identify the nuance and the dimensions of what those cultural norms and attitudes were that I really felt able to be confident to engage in this work.
Cool. So we'll get into the project spotlight, and it's about the YPG, if you hadn't already realised. So to help you understand how we can bring our strategy to life through the context, we'll put this a spotlight on the project that Sarah and I had working together along with the rest of the steering committee, which if there's someone in the crowd, I'll shout out to you. Thank you.
We probably haven't mentioned, but I was the advisor.
Yes.
That's how we met. I was the advisor on the inside. Jos, the chair of the steering committee.
Yeah, and deputy chair and leadership roles throughout a few years. But so realising the untapped potential of the young professionals group as a strategic influence and an asset for SA Health now and into the future, Sarah and I could both see the potential that this is needing to occur, but also our challenge. And it was a challenge to reposition and rebrand so we could make it more meaningful and make a difference for young professionals coming into the workforce. So how did we do it? Initially, we focused on establishing strong structures and governance from a long-term sustainability for the steering committee. For example, we embedded mentoring, peer support, and individual growth as a core functions for the steering committee and itself, and each other in that regard. We also made commitment to our members to enhance their system-wide understanding of the workforce development needs, bringing fresh insights into what sustainability looks like for the future workforce, from their unique perspectives to better understand the bigger picture for the healthcare system. We spent lots of time expanding our reach through diverse and creative pathways, ensuring engagement across state, LHN department and the statewide services professionals and generations. We actively encouraged one another to challenge traditional approaches to deliver impact, which meant generating meaningful outcomes within the public sector constraints and inspiring others for what could be done and what is possible. Most importantly, and essentially to our success over the last few years, was being resourceful and creative with our resources. We had to learn how to maximise our limited resources that we had, and in some cases minimal funding, to leverage partnerships to deliver high-valued initiatives, many of which we are very proud of in terms of our workshops, conferences and scholarships.
Yeah, what's that phrase? Necessity is the mother of innovation or invention.
Yeah, sometimes we didn't have much choice. We did do an incredible job with what we did have. And so the outcomes in that short time were incredible, particularly given that we're a volunteer group, which I couldn't highlight further, that we are a volunteer group and a small group of about 12 of us. We changed the way that the senior leaders in SA Health thought about us and now are investing in us for the long term and right now, which is exciting. We connected over 44 professions and achieved record attendances to our events, such as our conferences, which we've done 3 in the past, and our strategic launch event this year. We fostered true inclusivity, opening up our events to all ages, while still being true to our mission to support young and early career professionals. This sparked meaningful intergenerational collaboration and breaking down the silos between early career, mid-career, and senior leaders. We created alignment with our strategic directions, uniting SA Health young professionals under one common goal. We strengthened steering committee credibility through integrating an evidence-based approach to delivering high-quality and sustainable workforce development initiatives. And we've leveraged many partnerships as a core enabler to our success, collaborating with the services networks, external organisations to broaden our reach and amplify our impact and maximise shared resources. As you can see, this is our one-page of strategic direction, which was created by young professionals for young professionals. We designed everything, all the words on the paper are from us, and I'm incredibly proud of this achievement. And there's a bigger document that backs this one-pager. But you can see that with the timing of this as well is quite crucial. That we talked about the dates from 2025 this year to 2030, where we're going to see a huge amount of need for recruitment and retention and attraction. This document also aims to ensure our initiatives and resources are used in a meaningful way. There's lots of exciting opportunities coming up in the pipeline, and I really encourage you to watch the YPG space, whether it's through our email list or on our LinkedIn jump on, because there's lots of exciting things happening in this space.
So drawing on our experience working together over the past few years with the Young Professionals group and along our own professional journeys as well, our personal insights and research, we've identified 6 key strategies that we think will be most useful to unlock that untapped potential of a generationally diverse workforce. We'll explore each of these in a little bit more detail and share some of the real examples of how we saw them come to light through the YPG Spotlight as our project. As we walk through them, we invite you to think about how these strategies might apply in your own workplace and the impact that they could have on culture, which we know fosters collaboration and outcomes.
So we started with build connection through empathy and curiosity. Understand your own values, experiences, and influences, and stay genuinely curious about perspectives that have shaped others. In terms of this, it's about fostering empathy and curiosity and understanding individual values and influences that you have with the people that you work with. An example of how I went about this when I stepped up as chair as a young professional group was understanding the small group that I had, the volunteer group, understanding what their values, what their top 5 values were and what their strengths were. And this was really important in creating a new group together. A lot of us didn't know and often don't get to see face to face because we're all across the state, in creating trust and alignment to work on some really important initiatives, but also that was in our own time. The teams felt very valued and driven with our new initiatives, knowing the values that we all held and the similarities with our strengths or differences in our strengths to ensure that our initiatives worked well. Strengths through generations. Focus on what generation does well, explore their motivations and identify opportunities for shared learning and development. Each generation builds on the knowledge, strength and lessons from the one before. So for this, it's really about creating intentional opportunities, the time and safe spaces for conversations that draw on each generation's strengths and perspectives, enabling shared learning and deeper understanding. It's about, again, like we've said, who's around the table having those really important discussions. And the way that we went about this, there's a couple of examples for the YPG, is at our conference we host dual panels, one with the senior leadership and one with young professionals, and it's always like the most interested topic of our conferences. And we hear from different lenses, and everyone it gets people really thinking, and the opportunity to hear from different perspectives that makes it very interactive and enhances the learning and broadens that strategic thinking for the whole I guess, people that are attending and the different generations. Another strength with the 2 generations or different generations working was when we co-facilitated the planning workshop for the strategic directions. We had a younger professional co-facilitate with a much, much more experienced leader. And the results from that was just incredible. The energy in the room, the respect both ways we almost created the whole one-pager in the one day with professionals from across the network, and it was just incredible how efficient we were, and that's really just showing things can be actioned with different perspectives and diversity in the room.
The next strategy is adopt a yes and mindset. So using this improv principle to build on ideas rather than dismiss them, because it helps to create that space for innovation because you're building on those ideas rather than casting them away. I think about when in my role as the advisor, I would have very excited, interested, passionate people coming to me with all of these ideas, and you know, it is really difficult in a lot of cases to guide that feasibility because my role was to guide them in the risk of a system. So I started taking a yes and approach to mentoring the steering committee members. And what that looked like was, yes, and have you considered this? Yes, and we also need to make sure that we don't breach this policy. Rather than immediately responding with no and discrediting the ideas, the improv principle is so important because it encourages innovation while helping us to manage our organisational constraints. The other thing, and you've already said it was such an important thing that you wish you had within your careers, is mentoring. What we're talking about here is leveraging reverse mentoring, so inviting fresh perspectives to challenge the assumptions and spark innovation. This is the idea that people can learn from one another and dismantling the previous existing approaches but still maintaining the impact that mentoring has as a long-held, impactful way to build and grow capability. It means that we're able to talk to one another and share from another, rather than having that fixed mindset that age comes wisdom. You can learn and share your experience both ways. And even for myself, again, as the advisor on the committee, I found it strange thinking that I was advising as a young professional to young professionals on these activities. And that was just an example of how challenging age-based assumptions about expertise can really lead to wonderful development of initiatives. It sparks innovation and it creates a mutual understanding and respect.
One of the best pieces of advice I received a while ago while actually attending a young professional workshop as a young, not a committee member, was, I guess, asking someone to be your mentor. What's the worst that could happen? They say no. Okay, you haven't lost anything, you haven't gained anything. But there's a chance that they could say yes. And I've asked lots and lots of people for mentorship, and I've never had a no. I've had a yes, but maybe one session. But I really recommend you do have to step out a little bit of your comfort zone, but I'd really recommend that you do reach out to someone that has inspired you or sounds interesting to you around that. Mentorship doesn't have to be more formal, it could be informal, it could be one-off, but I really think that encourage everyone to do that and take their own initiative in that space.
And thinking about, for those setting it up in organisations, the idea that, you can co-design what a mentoring approach would look like for the people that are involved. And that also means what mentoring might feel like and look like for people at both ends of the generational spectrum.
Mastering the art of constructive feedback. Give feedback and receive feedback with openness, empathy, and focus on growth across all ages and all career stages. I think it's just really a vital piece, and back and forth. And I think we can all continue to improve on our feedback mechanisms. As you would hear through the generations, we are expecting more feedback quickly, constructive, and across 2 ways across all the levels. An example I think that we really thrived with the young professionals was when we were looking at our strategic directions and diving a bit deeper into our priorities and our wellbeing priority. We reached out to one of our known partners around the work that they were doing on wellbeing, and they gave us some great feedback on what we were doing with our wellbeing priority to ensure that it was actually going to be useful and achievable for the young professionals. And that really just created a great environment. It allowed us to be very focused and outcome driven to that strategy, while also creating a learning opportunity for that group that was working on that particular priority. And finally, notice the little things. And that might sound a bit funny, but it's the simple gestures of mutual respect, curiosity, keep saying curiosity, and appreciation that can foster trust and strengthen intergenerational cooperation. Recognise those micro actions of building respect and connection really does go a long way, and I think we probably underestimate just how much that means. A simple greeting from your CEO or a high-level executive in a lift or at a conference is a small gesture but reinforces that value of belonging, and I think we did that quite well from a YPG perspective, and it's opened the doors for so many opportunities and for that next step to have those conversations and reaching out to those higher level senior executives. And we wouldn't have been able to achieve what we've achieved today if it wasn't for those small gestures and having that confidence then to reach out. So I really, if you are a senior leader or if you're not, please think about those small micro things and the value of kindness and those smaller moments that can strengthen the engagement and the trust in a large system.
Innovation doesn't have to be huge. It can just be, the simple asking for a mentor as the example you gave. So to summarise what we've talked about and try to get into Q&A as quickly as we can, the potential of an intergenerational workforce means that if we want a sustainable, future-ready healthcare system, we must see the intergenerational workforce not as a challenge but as a solution. That means investing in things that are going to create mutual respect and inclusion in the workplace. Collaboration flourishes when every voice is genuinely valued. You can see all of those there on the slide. And as we continue to think boldly, opportunities like the intergenerational panels, for example, or, in the little things, creating a young professional shadow board is one thing that I've been thinking about. all of these different ways of building on the old and coming up with a new way of working and learning together are all going to set organisations up for success and take that impact back to our consumers.
Wow. Okay, so today's conversation has hopefully sparked some ideas for you, either big or small, that you can take back to, and put into practice straight away. I really want you to have a think about that, and hopefully that you can do even just one meaningful change that will often begin with one thought, one action, one conversation. And that was really what Sarah and I wanted to achieve out of today's presentation. And I know you're all incredibly busy because you all work in health. So thank you for your time, your attention, and the work that you do for our communities and our loved ones. We share this with you and hope it inspires you to keep exploring the incredible potential that an intergenerational workforce can give.